Hello, I'm Dr. Michael Lau. The following is a presentation that I gave at the 22nd Congress of the European Society of Sexual Medicine. Took place in 2020 in Prague, Czech Republic. It's a long title, but basically I'm just using a mathematical engineering model to study female sexual dysfunction and also using mindfulness therapy to help with such disorder. It's a professional technical presentation, but I think some of the material in there may be of interest and helpful to the general public as well. So what's the reason for this presentation? What will be of interest, even though it's a professional technical presentation. Some of the audience in the conference asked for the copy of the slide deck, so I'm including this as well. So the question you can answer is, what factors affect satisfaction and intimacy? Can we model the process of sexual dysfunction? How can you use this process model to help improve intimacy? And what role does perception or predictive perception play in intimacy? How do you use neuropsychology and mindfulness to contribute to understanding and treatment for intimacy or sexual dysfunction? So this is the voiceover of the presentation I gave in Prague. This presentation is created in conjunction with Professor Leonard Pease, who is Professor of Engineering and Pharmacology at the University of Utah. I want to thank Leonard for his contribution, especially on the mathematical modeling and the PLC model control process. So why this discussion? I think the female sexual interest arousal disorder is a really common problem. It's challenging to treat, and medication are often not very effective, also a lot of side effects. So people have turned to the mindfulness-based cognitive therapy, or called MBCT, report to help, but still in the preliminary stage, but need to understand the mechanism of the disorder and need to understand the mechanism of the treatment. And then I think you better use a model, as you do in physics and engineering, to visualize and quantify those parameters. That's why this particular study and presentation. So female sexual interest and arousal disorder, there's very complex in terms of contributing input factors. The physical factors such as sensory input like sound, sight, smell, taste, tactile. Also this element of interoceptive awareness, how your body inside feel to certain external stimuli, for example. And there's also the neuropsychology behind this is modified by predictive perception, basically statistical Bayesian inference based on memory, user, and data. So what's predictive perception? If you look at this picture in black and white, you really have no idea what it is. I can't tell what it is. However, if you add color to this picture, then it becomes very obvious there's a butterfly on some blackberries. So you look at this black and white picture again, you can tell, your mind tells you, oh, this is a butterfly on blackberry bush. So we thought to model this process of looking at sexual interest and excitation and the dysfunction thereof, maybe we can use an engineering model or programmable logic controller, PLC model. This is a block diagram. Basically, you see from the sensors have input on the left side. You go to input modules, go to the processor, and then process it, outcome to output. So how do we put that in the context of what we're looking at? So using a similar model of PLC applied to female sexual dysfunction and the mindfulness-based cognitive therapy. The inputs are external stimuli like sight, sound, smell, taste, tactile. And then you have the introspective awareness, how your body feels inside. and then go to the input module. Well, it's affected by predictive perception, as we've shown before, right? Your mind, because of the memory and the data stored in your mind, have some predictive perception already of any input that comes in. And then that's further affected by the user memory and the data memory. And that all goes to the central processing unit. Again, you have applied this user memory and data memory in the brain, and then you come up with the output autonomic rotor response during intimacy. And you have feedback loop. And then at any given point for the input module and also the central processing unit, it can be affected by the mindfulness-based cognitive therapy. Basically, it could be more the peripheral, downstream, intimate attachment, or in the central level, cognitive appraisal. So basically, this is an example engineering model of the process control loop. You have the controller output, and then you have feedback and reset the control process. So how can we use the engineering model to apply to treatment for female sexual dysfunction? So you can look at the top, you can have the input and see what is expected, and compared to the goal, the difference, go to therapist, intervention, affecting both the women and men, but in this case, we are concentrating on the women. And then the loop goes back to survey how this working, feedback to the original process. And the lower diagram show again, the intervention will affect the woman, both in the memory, predictive perception, and the interoceptive awareness, and all tied to the response, either autonomic or motor response. So one can do statistical analysis of the process control. The idea is you want the response to be as close to the target goal as much as possible, which can be outlined over time, as demonstrated by the diagram here. Well, you might ask, this is so mathematical. Does it make sense? Actually, Professor John Goodman at the University of Washington had actually figured out the mathematics of relationships. You can see as an example, y at time t+1, her behavior or response is a constant plus the past behavior, add to that, and husband's influence. So basically you can see some baseline, your past predictive, perception, and then external force, her husband's influence on him, based for same thing for the husband. So this study and our purpose for this presentation to this audience is to stimulate interest in using a mathematical model, and the control process to study and understand female sexual dysfunction and how we can apply a therapy, in this case, the mindfulness-based cognitive therapy, in treating that. We can learn how to classify MBCT according to the mechanism, whether it's bottom-up, intimate attachment, or cognitive appraisal, top-down. And then we can apply the optimal mechanism for each person in treating the sexual dysfunction. If you can, we can quantify the parameters in the mathematical formulation to design a treatment optimized for female sexual dysfunction. So this is the conclusion of the presentation I gave in Prague, Czech Republic. I'd like to invite you to browse through the video in my video library, covering various topics from cosmetic vaginal surgery to attraction, perception, and intimacy. And We see patients from all over the world and happy to do any teleconsultation. If you just go through my office, the website listed, and contact them to set that up. Take care.